plantar fasciitis, or heel pain, affects up to 17% of runners every year, and it can be really frustrating to deal with. If you have pain every time you walk, run, or especially when you get out of bed in the morning, then plantar fasciitis might be the cause. But the sticky part is, it's really difficult to treat. In this video, I'm going to break down exactly what plantar fasciitis is, what causes it, and more importantly, I'm going to show you a roadmap that you can follow to get out of heel pain fast so you can get back to running the miles you want. So if you've been dealing with heel pain and you're looking for a solution, this video is for you. Hey everyone, I'm Dr. Kevin Vandy, physical therapist and running specialist, here to break down the cause of plantar fasciitis, what it is, and I'm going to show you 7 different exercises you can do to get out of heel pain fast. But first off, what is plantar fasciitis? It's a mouthful to say, right? So this is a foot model. This is the bottom of the foot. This is the top of the foot. Plantar means the bottom part of your foot, and fascia means connective tissue, which is this blue tissue you see here, extending from the heel all the way to each individual toe. Now, the fascia connective tissue, its job is to support the mid part of the foot and to absorb shock. So every time you land when you run, your foot will pronate or collapse inward. When it does that, it will elongate the plantar fascia, it will store energy briefly, and then have a recoil that pushes you forward. The problem with plantar fasciitis is too much load is placed upon that tissue, and you get overuse. The fascia will pull on the bony attachment, and that's why you often get pain right at the base of your heel every time you take a step, and more what you're going to feel is that very first step in the morning. Oh, you're going to jump, ow, big pain, right? I've had it. It is a bear to treat, but you can overcome it. So what are the other risk factors that cause plantar fasciitis? In terms of running mechanics, one of them is overpronation. So when your foot collapses too far inwards. Again, some pronation is good because it allows you to absorb shock. Too much pronation, however, it overloads the shin muscles that control your foot. It overloads your foot muscles, and when they meet their capacity, then that energy gets put on your plantar fascia and causes injury. Vice versa, you can also underpronate, so you don't let your foot roll in at all. When that happens, there's a lot more load placed on the passive structures like your bone and fascia. When that happens, you have a very high force placed upon the tissue that also pulls on the bone, and that causes inflammation and pain. So those are 2 very common mechanics that lead to plantar fasciitis: ramping up your miles too fast. Having a high BMI or body mass index is another risk factor for developing plantar fasciitis. So you may have seen people roll their foot on a frozen water bottle or mash their foot with a lacrosse ball. If you've tried it and you have plantar fasciitis, it is painful and uncomfortable. The thing is though, it probably doesn't work. Your plantar fascia, this tissue, is a very thick, strong tissue. And when you try to mash it with a ball, it's so thick that you really don't change the tissue at all. So you're really just causing yourself a bunch of pain. That is not a recommended treatment for this condition. What is recommended though, strengthening has been shown to be effective, so strengthening your calf and foot muscles. Stretching has been shown to be effective, stretching your calf, your muscle that sits behind your calf called your soleus. And also stretching the plantar fascia itself, which I'll demonstrate later in this video, has been shown to be effective. And also a therapy called shockwave, which is high pulse sound waves that get put on top of the foot and go into the tissue, causes microinflammation and healing. That's also been shown to be effective. So if you have this condition and you're close to a clinic that has shockwave, when you combine that with stretching and strengthening, the drills I'm going to show you today, that is the best treatment pathway, the best roadmap for getting over plantar fasciitis. Now you may be asking about orthotics. Those can also be effective in the short term, but an orthotic sits underneath your foot, and because your foot's a really cool structure, acts like a suspension bridge, you don't want to leave too much support under the foot for too long. Your foot will get lazy and the muscles of the foot won't be as strong as they used to be, and that could again lead to a risk factor for injury later on. So that's what plantar fasciitis is, what causes it. Now what I'm going to show you is how to get over the pain through 7 different exercises that involve stretching, strengthening, and the mechanics of how you run. So let's dive in. The first drill we're going to go through is a plantar fascia stretch. So again, your plantar fascia starts here at the heel and goes all the way through your foot to your foot bones. So to stretch this tissue, we need to pull the toe backwards to expose a stretch on the muscles of the bottom of your foot. So what you're going to do is you're going to use a wall, and you're going to have your toe up against a wall so it bends, and you're going to, as you press load into the toe, you're going to move your body weight over the foot, and you're going to try to put the ball of your foot on the ground and keep your heel on the ground. You're going to feel a stretch in the bottom of your foot, and you're going to hold this for 1 to 2 minutes to allow a great stretch of the muscles in the bottom of the foot. It's okay if it's a little bit painful. It's not going to cause any damage to the tissue. The next stretch we're going to perform is a stretch for the deep muscle of your calf called your soleus. This muscle is stretched when there is dorsiflexion or bending of your ankle, and also when you bend the knee. So you're going to put your weight onto the affected leg. You're going to let your knee bend forward to the wall while keeping your heel on the ground. And what you'll feel is you'll feel a stretch in the top part of your Achilles tendon and the bottom part of your calf. And again, you're going to hold that 1 to 2 minutes to get a good stretch. The next exercise is called a short foot exercise. So this is the arch of your foot here, your long foot arch. What happens with plantar fasciitis is that arch collapses. The bones of the middle of your foot roll inwards, put pressure on your foot arch, and that ultimately puts pressure on your plantar fascia. So the job of this exercise is to build up your arch by using the intrinsic or core muscles of your foot. So what you're going to do is you're going to try to pull the ball of your foot back to your heel. So you're going to drive that foot, it's going to stay on the ground, you're going to drive the ball of your foot back to your heel. You want to try to avoid curling your toes. Those aren't the muscles we want to target. We want to target the muscles in the arch of your foot and even the muscle that goes up your shin. So it can be difficult to do at first. You're going to want to curl your toes. Don't. Just try to drag the ball of your foot back to your heel so you feel all these muscles in your foot arch contract. Again, this is called a short foot exercise. It's a great drill you can do while you're at work, while you're sitting watching TV. And you want to do the short foot, hold for 10 seconds, relax. Hold for 10 seconds, relax, and you want to do a lot of these during the day to really build up your foot muscles, which will provide support for your plantar fascia. The next drill is called piano toes or toe yoga, and it's a challenging drill but an effective drill because it's going to build up the muscles in between your toe bones, again supporting your foot and your fascia. So you can see me doing it here where I'm pressing my big toe to the ground but lifting up my 4 other toes, and then putting my 4 other toes down and lifting up my big toe. And I'm repeating back and forth. And you can see the muscles of my foot activate to perform this coordinated motion. Again, it'll be frustrating at first, but well worth doing because you'll be building up muscles of your foot maybe you haven't utilized in a long time. And that can do a wonder in terms of supporting your foot while you run. You want to do this a few minutes a day, no set reps, just a few minutes a day to train these muscles and build up the coordination of your foot. The next exercise is a drill to improve the mobility of your ankle joint. Studies will show that many people who develop plantar fasciitis lack range of motion in the ankle when they run, and that places greater load on the calf, and that tissue eventually becomes the fascia on the bottom of your foot and bothers your heel. So this drill, you're going to keep your heel on the ground, your forefoot on the ground, your foot's going to remain straight. You're going to add some weight or load to the front of your leg, and you're going to shift your body weight forward over the ankle. So the range of motion in your ankle is increased. You're going to hold that for 1 minute to 2 minutes, and you're going to do that a couple times per day. Again, you just have to hang out in that position a long time to get a good mobilization of that joint. This exercise is a drill to build the muscles on the inside part of your shin, and their job is they're the main support for your foot arch. So they directly help your plantar fascia. You're going to use a ball or a towel in between your heels. Feet are going to be pointing straight, and you're going to do a calf raise while squeezing into the ball the entire time. Slowly up and slowly down, driving your heels inward, pressing through your big toe so that you build the muscles on the inside part of your shin. The goal here is to do 20 repetitions for a couple of sets every other day. The final drill you're going to do to support your foot for running is a split squat or a lunge. You can do either one, where the goal is to control your foot arch. So you don't want your foot arch to collapse in, and you don't want to be on the outside of your foot. You want to be doing the short foot like we practiced earlier, doing the short foot as you squat down and rise up, squat down and rise up. Now, as your body weight goes down, you're going to be tempted to let your foot arch collapse. Don't let that happen. Keep the short foot the entire time by pulling the ball of your foot back to your heel. Ideally, do this in front of a mirror so you can see your leg position and foot position. And you want to do 10 to 12 repetitions, 2 to 3 sets. All right, guys, so there you have it. There are 7 drills you can do to get out of plantar fascia pain fast. If you got value from this video, I'd love if you hit like, subscribe, hit the notification bell so you're reminded when my new videos come out. Also, check out this video here. It's another video I made for runners dealing with leg pain, but it has great exercises for dealing with alignment issues that can help also with your heel pain. All right, guys, till next time, train smarter and perform better.